Hello guys, Kamini Such here, and today I'm going to teach us a new word, and that word is what? Halitosis. Simply put, bad breath or mouth odor. Now, this is caused mostly by sulfur producing bacteria, and they are found on the surface of the tongue and on the throat. I don't know all these bad children where your mind is going to. I'm only talking about bad breath here. So we now have causes. There are different things that can cause it. Number one is dental factor. Dental factor in the sense that when you have poor oral hygiene, or when you have infections of the mouth, like if you have mouth infection, it can bring about bad breath or odor. Number two thing that causes bad breath or mouth odor is dry mouth. This can be because you're stressed, it could be because of medical condition, it could be as a result of medication or even alcohol or dehydration. That is why it's always good to take plenty water. Just stay hydrated, taking water regularly as much as you can. It does not kill. Drinking water does not kill. Number three is smoking. Smoking, this kind of emits the oxygen that gets into our body, and then bacteria, because there's no oxygen and they breathe well in such environment. Then we have foods like onions and garlic for those that eat it raw. It has its health benefits, yes, but allergies. Signs and symptoms: one, we have saliva, we have bad breath, and this is usually seen in the morning. Now, number three, we have white coating on the tongue. Number four, we have burning tongue. Your tongue seems like a bit burning. Then, last but not the least, we have dry mouth. The treatment is quite simple, guys. You treat it according to the cause. Now, if it's as a result of dry mouth, stay hydrated. Quit smoking so you can have enough oxygen. Then, if it's as a result of garlic or onions, you stop eating them raw. Then if it's as a result of dental factor, what you need to do is to maintain good oral hygiene. Now, in the situation whereby you have done, like, you've treated these factors and then you still have the bad breath, it is recommended that you visit your doctor for them to prescribe a good antibiotics for you, and then you go for regular checkups as well. So that is what I have for us today. I hope you enjoyed it and you learned something. Don't forget the name, Halitosis. Please do like, comment, and share. Thank you.